No, we're not.
Okay, 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 okay.
Have you done this before, Sally?
No,
No.
not with this group, no.
Talked her into it. You are our first international guest, Sally.
Oh, really? Woo.
Hello, good evening everyone, and a very warm welcome to another Catherine McEwan live session on Facebook. My name's Richard Russell and I'm a consultant paediatric gastroenterologist in Edinburgh. It's been a while since we've seen you actually on Catherine McEwan Live, so it's very nice to be back again. And I'm delighted that we have another excellent session planned for you this evening. I think since the last time we met and we were starting to plan this session, vaccination has become such a topical issue for everyone. So I'm delighted this evening to have two special guests to talk through the topic with us. So I'd first like to introduce sister nurse practitioner Jennifer Howitt, who's a practice nurse in Dumfries in the south of Scotland, and she's here to give us very practical advice on questions around vaccination. Good evening, Jenny.
Hello.
Very warm welcome. Thank you very much for joining us. And our second guest tonight is Dr. Sally Lawrence. She's a consultant paediatric gastroenterologist in Vancouver, Canada, and I think I'm safe to say she's our first international guest on Catherine McEwan Live. She's here to give us a special perspective on vaccinations in IBD patients. And while she's giving a short presentation, it would be really great for you to start to get your questions in on this. I know from all the special interest around this topic, there's going to be lots of questions. And the earlier you get the questions in, the more likely they are to be answered. So please get your questions going now. We're going to go over to Sally. Sally, hello.
Hi there, can you hear me?
Yes, the link to Canada works. So we're going to start with Sally's presentation, and as she's giving it, please think up your questions, please post them, and we'll be back after the presentation to answer as many of your questions as we can. Over to you, Sally.
Thank you, Richard. It is such a pleasure to be here tonight to talk to you. I'd really like to say thank you to the Catherine McEwan Foundation for inviting me to speak. It's such an honour. So, John, can you pop up my first slide, please? So really, preventative health is such an important part of managing patients with inflammatory bowel disease. And so tonight we're going to be talking about preventing infections through vaccination for our inflammatory bowel disease patients. We at slide 2, please. So objectives. Essentially, we'll have a quick look at how vaccines work and the type of vaccines that are currently available. Then we'll review why it's so important for our patients with IBD to be vaccinated. And then we'll look at some of the vaccine recommendations with a focus on the flu vaccine and possible COVID-19 vaccines. Next one, please. So vaccination is a simple and really effective way of protecting people against harmful diseases before they even come into contact with them. So how do vaccines work? So the disease-causing bacteria or virus is introduced into your body in a very weakened or in a dead form. And that can be done by an injection or a nasal spray or oral ingestion. And your body will take the vaccine and present it to the immune cells that are represented in white. These cells they're the T and B cells, increase in numbers, and they'll direct your body to make antibodies. So antibodies are those wee green structured Y-shaped structures on slide number 4. And these antibodies will help to block the virus from infecting cells. Next slide. So, yeah, slide 5, yes. So in the future, if you come across this virus or bacteria again, new antibodies against the bug will be formed quickly, and that means that you're able to fight the infection. Over to slide 6. So let's just talk about some of the vaccine types. This is a bit of a busy slide, but I'm going to talk you through it. So what are all the different types of vaccines? This is quite useful information to understand at the moment because people are doing quite a lot of talking about the different COVID-19 vaccines. So in the top left-hand corner, you can see your nasty virus, which can cause disease, and you're wanting to create a vaccine. So if you look to the right-hand side, vaccines can be split into either live vaccines that are highlighted in red on the right, or non-live. So live vaccines are vaccines that are significantly weakened form of the bug. They usually result in quite a good immune response, so you get loads of those green antibodies. We have to avoid these vaccines in our patients who are on immunosuppression, and I'm going to be talking about that in a bit more detail later. All the other vaccines are non-live, and they can be given to all of our IBD patients. So starting from the right, you have non-live vaccines that can be the whole killed vaccine, or you can just have bits and pieces of the vaccine that get injected in. And these bits and pieces can be injected into another virus and given to you. And quite a few of the COVID vaccines are like that. Other COVID vaccines are just injecting bits of genetic material from the bug, so your RNA and DNA. Also, there are virus-like particles, and they can mimic and look a bit like the bug, and they can be used. Or you can just use a wee bit of the protein from the bug, like this spike you can see on the left-hand bottom side. And that will still generate an immune response, so those antibodies get formed. So vaccines can be live, they can be non-live, they can be whole vaccines, or you can just have bits and pieces of the vaccine used. Okay, next slide. So this is important. Why do we want to vaccinate our IBD patients? We know that patients with inflammatory bowel disease have an increased vulnerability to infections. There's increasing evidence that patients with active inflammatory bowel disease are just not able to mount the same immune response to certain bugs, especially when the disease is really inflamed. The immune system is just not working effectively, and that can result in an increased risk of infection. Things can be exacerbated or made worse by malnutrition, so when you're just not able to get in the nutrients that you need. But the main reason why you're less able to fight infections is because of immunosuppressive therapy. So what is immunosuppressive therapy? These medications include things like steroids, methotrexate, azathioprine, your biologics like infliximab, adalimumab, vedolizumab, ustekinumab, and other medicines like tacrolimus and cyclosporin. So these medicines are really important to ensure your IBD is under control and to keep you symptom-free, allow you to grow and go through puberty. Immunosuppressants are also really important to help prevent all those horrible IBD complications like bowel strictures, fistulas, and cancer. But they do come with side effects. It can take you longer to fight an infection. And one huge thing that we can do to prevent this is to vaccinate against vaccine-preventable diseases. Next slide. So current guidelines in Europe, America, and Canada recommend that all of our IBD patients should get age-appropriate vaccinations really as soon as possible after diagnosis, and ideally prior to the initiation of immunosuppressive treatment if possible. There is some evidence that while you're on immunosuppressive therapy, it may reduce your response to the vaccine. And as I'll be talking about a bit later, live vaccines can't be given while you're on this treatment. Luckily, based on the current evidence, there is no convincing signal that you will have a flare-up of your IBD after being given your vaccinations. Another important point to bring up is that urgent IBD treatment should not be delayed to provide your vaccinations. It's really important that we treat your IBD rather than delay it. And so in that situation, vaccines just have to wait. And a final important point is being proactive. It's really important that you think about your vaccines, bring your vaccine records when you go and see your doctor or your GP and have a chat about whether your vaccines are up to date and get that optimized. So I wonder if we can move to slide 9 now. So I just wanted to delve a bit deeper into vaccines for IBD patients, and I've split the topic into non-live vaccines. So live vaccines are given during the UK vaccine schedule, and they include things like the infant rotavirus, your measles, mumps, and rubella that are given at 1 and 3 years, the nasal flu spray, which is given from the age of 2 each year throughout your primary school, and then herpes zosters, that's the shingles vaccine. It's given to people in their 70s so they don't get that nasty, painful rash. We recommend that IBD patients should get all of their live vaccines unless they're on immunosuppression. And we've talked about the immunosuppression drugs, your steroids, methotrexate, azathioprine, and your biologics. So while you're on this medicine, there is a theoretical risk that the vaccine, the live vaccine, could actually cause a viral or a bacterial infection because your immune system just isn't reacting appropriately. So we tend to try and give all of our vaccines prior to immunosuppression treatment if we can. There are a couple of other non-routine live vaccines like chickenpox and some certain travel vaccines like yellow fever. Not that we're doing an awful lot of traveling at the moment. These vaccines just can't get given while you're on immunosuppression. Next slide. And so in addition to the live, you've got your non-live vaccines, and there are a whole range in the UK immunisation schedule. I won't go through everything, but diphtheria, tetanus, pertussis, polio, Haemophilus, Hep B, human papillomavirus, to name but a few. Essentially, all of these are recommended, even if you're on immunosuppression. You don't need to stop your medication. You can't get the infection because it isn't a live virus. It's just bits and pieces of the bug that are killed. So it's safe to give. It is true that you might not mount as strong an immune response, as I said before, when you're on immunosuppression, but it is still better to give the vaccine rather than not at all. So I just wanted to highlight one of the important vaccines, and that is your flu vaccine. I wonder if we can just move on to the next screen. So flu or influenza is quite a nasty virus. It presents with nasty cough, runny nose, fever and fatigue, but it can actually progress to chest infection, need for hospitalization and even death. So how does the flu affect patients with inflammatory bowel disease? A recent study looked at 140,000 patients with and without IBD and looked at rates of flu. And they found that IBD patients were more likely, almost 30% more likely to get the flu than the background population. And they were more likely to have disease complications needing to be hospitalized. Despite this, really around the world, what we're seeing is that vaccination rates are extremely low. And that's something that is very concerning. Can I just check, can you still see me? You can see me? They can't. That's
see your
fine.
presentation.
Perfect. I just can't see your screen at the moment, but that's totally fine. If we can move on to the next slide, that would be fantastic. So to highlight, how important the flu vaccine is a little bit further, there is a pediatric Canadian study, and that compared IBD patients who got the flu vaccine with those who did not. And this study showed that there wasn't any evidence that the flu vaccine actually caused a flare-up of IBD. And in fact, children who actually got their flu vaccine saw their doctor less frequently than in years when they didn't get their vaccine. So we know that viruses can cause flare-ups of IBD, The theory behind that is that viruses may alter your immune system and possibly change your gut microbiome, which can lead to a flare. So the theory is that getting your flu vaccine will prevent you from getting the flu, which prevents a flare-up of inflammatory bowel disease, which is really important. And so around the world, we really recommend giving the flu vaccine each year for all our IBD patients. The current UK guidelines recommend the injectable Nonlive vaccine if you're immunosuppressed, and everybody else would get the nasal spray. Next slide, please. So are there any additional considerations we need to think about during the pandemic? So at this stage, it's unclear what COVID-19 and flu, if we get it together and have inflammatory bowel disease, what that will do to a patient. There is a possibility that it could lead to quite severe respiratory symptoms and pneumonia, and this is not a chance that we're wanting to take for our patients. We also know that each year the flu leads to system overload in our hospitals, and now we have COVID-19 on top. We know that sick people get the best care when in hospital, when the hospital isn't overstretched, people aren't overstretched, and there are enough supplies. So really thinking about getting the flu vaccine is important for safety reasons. And thirdly, if you think you have symptoms of COVID, but it's actually the flu, you still have to take time off school, time off work, get your COVID test and wait for results. It's probably best to avoid getting flu-like symptoms at all and get your flu vaccine. Go to the next slide. So seeing as we're talking about COVID, let's have a quick look at the vaccine development during a pandemic. So traditionally, when you're making a new vaccine, development takes a really long time. It's a long process. It starts in the lab. Phase 1 would be safety trials in humans with only maybe 50 patients. Phase 2 is a bigger trial looking at safety and how the body responds with maybe 500 patients. Phase 3 is much larger. It looks at safety and how effective it is. And usually you have tens of thousands of people involved in this. So during this pandemic, there's been quite rapid turnaround time for the research, trials, and testing. But the vaccine still has to go through all of these phases before it can even be considered to be approved. So next slide. So where are we with the COVID-19 vaccine? There are over 200 vaccines that are between the preclinical and the phase 3 trial. None of them have been approved yet. 12 of the vaccines are in the phase 3 trial stage, so fairly far on. They're all non-live, so theoretically we could give this to our IBD patients who are on immunosuppression. There have been 3 vaccines that have been highlighted in the press, the Moderna one, Pfizer, and the Oxford vaccines. The very preliminary data is showing pretty good effectiveness with between 70 and 95% effectiveness, but it is really important that we wait for the published data before moving forward. And in terms of side effects, there don't appear to be any serious safety signals. Side effects noted have been things like fatigue, headache, and muscle cramps, but we will need to wait for the full published rigorous review before we make any further kind of judgments. And in terms of who's going to get the vaccine, so the UK Joint Committee on Vaccination and Immunisations has issued a preliminary guidance plan. Elderly patients who are in care homes and those people who work in care homes would be first, then patients who are older than 65 and healthcare workers, followed by high-risk patients who are under 65, and then the rest of the population. But guidelines need to be fully defined. So although it is really exciting, it does appear that hand washing, physical distancing, and masks are still going to need to be required for the foreseeable future. And what about families who live with IBD patients? What recommendations can we make? Around the world, we recommend really that family members, household members receive all their age-appropriate vaccines. They should get the yearly flu vaccine. They can get all their live vaccines. The one caveat is for immunosuppressed IBD patients, it might be worth getting a free pass to avoid nappy changes for the 2 weeks after baby gets the rotavirus vaccine because it's shed in the stool. There have to be some perks. So final thoughts, really worth bringing your vaccine record to see your doctor and have a chat around your vaccines. We recommend, and around the world, everyone advocates for giving all routine vaccines, usually, if at all possible, before you start immunosuppression therapy, because you can't give live vaccines while you're on immunosuppression. Families can have all their recommended vaccines as well as the flu. And really, especially this year, please consider getting your flu vaccine and stay safe. Thank you.
Sally, thank you very much. What an excellent and comprehensive talk on vaccines there. And you'll be glad to know that you've generated lots of comments and questions. One person actually asked, how long is this presentation? But when you were asking people if they could hear you or see you, you got lots of answers to that as well. So
okay.
people are paying attention. In terms of the questions we're getting in, there's about a 50-50 split between questions about the COVID vaccine and about other vaccines. So I'm going to try and answer all of your questions, everybody, but there are quite a few questions that are similar. So I may group some of those together. So I'm going to start just by Lucy Proctor, who's a very frequent follower of all of the presentations on Catherine McEwan Live. Thank you, Lucy, for your question again tonight, and thank you for watching. Lucy is asking about Sammy, who's got IBD, but has come off medicines because Sammy's had an ileostomy. Should Sammy still get her flu jab this year, as she didn't get a letter like she's had in previous years? So who wants to start? Jenny, do you want to start that one?
Yeah. So what age is Sammy?
I don't know, but Sammy is a child.
Okay. So yeah, she should still get flu vaccine. If they are still at primary school, then that'll get offered through the school. It's changed this year. Instead of GPs taking control of them, the vaccines, it's been the local health boards that are doing it, and I know that they are doing it age blocks. So they started with elderly people and they're kind of working their way down. So if they've not heard yet, they should get a letter soon, and if they don't, then contact your own GP practice. They should be able to give you the phone number to give them a phone just to see that, check that you're on the list and eligible.
Okay. Excellent advice. Sally, anything you would like to add to that?
No, just an excellent question, and I would completely echo what Jenny has said. We would be recommending definitely getting the flu vaccine.
So while we're on the flu vaccine then, in terms of, there are obviously two different forms of the flu vaccine. One comes as the nasal vaccine and one comes as the JAG. Which is for which patient, Sally?
Yes, so the nasal spray is a live vaccine. So it can only be given to people who are not on immunosuppression. If you're on any of those drugs that we mentioned, so the steroids, methotrexate, azathioprine, your biologics like Humira, infliximab, Fido, or ustekinumab, these medications will dampen down your ability to fight off bugs. And so you shouldn't get the nasal spray. You should get the injectable form, which is a non-live vaccine. So it's a killed vaccine that can't cause you any problems. Okay.
Anything practically there, Jenny, in terms of where you get those vaccines? Can you both get them at your GPs or?
So no vaccines really available through the GP practice unless it's the immunisation team from the health board that are having a clinic there. But yeah, both available from the immunisation team. The only other thing about the nasal spray is that it does contain a bit of pork derivative. So some people, for religious or cultural reasons, choose not to have the nasal spray for that reason. and they should just let the immunisation team know that they would prefer the injectable form for that reason.
Excellent, thank you very much. Okay, so we're on to pneumonia vaccine now, so Pneumovac. So Christelle Needham, thank you very much for your question, and thank you for watching. How often should IBD children have the pneumonia vaccine? My son is on methotrexate and infliximab. Sally, do you want to answer that?
So really, in the pediatric world, it's just part of your routine vaccinations. So you're not actually needing anything extra than what is provided through the UK vaccine schedule. And I think as an adult, there may be the need to be giving the there are two separate pneumococcal vaccines that require to be given. There's the 13 and the 23, and maybe Jenny can go into that in a wee bit more detail, but that tends to be something that's done, given in the adult immunisation programme. So yeah, just following your routine UK schedule for vaccination is what we currently recommend.
Okay. So important to keep with the schedule. Jenny, anything you want to add to that?
No, it's usually just for adults. It's usually just a one-off, unless people don't have their spleen, then it's every 5 years. But usually it's just once that's required. Okay,
great answer. So I'm going to start to talk about some coronavirus vaccine questions because there's lots of them. Yeah. And then I'm going to come back to some of the other questions. Some of them are similar, so I apologise if you've posted a question and I don't say your question out, but I'm going to try and get through them all. So starting with Alexandra Clark, thank you for your question. Will the vaccine, by this I think you mean the coronavirus vaccine, be safe for immunocompromised patients who take medications such as Amgevita or Mercaptopurine? I am high risk in shielding, hope the vaccine will make a difference. So, as Sally said, the rollout of the vaccination programme will be not coming to IBD patients first. So I'm sorry, for the vast majority of IBD patients, you're not at the front of the queue for the vaccine. In terms of the vaccines...
Unless you're over 65.
Unless you're over 65. So I know most of the people who are friends of the Catherine McEwan Foundation are of all ages, but most of them are not over 65. So if you are, it's fair to say that. The other aspect of the question is, can you get the vaccine if you're immunocompromised? And Sally, I think, went through lots of them, but the Oxford vaccine, I think, is live, Sally, and then it's not?
No, it's a viral vector. So that's where it's a non-live vaccine that basically they've taken little bits of the genetic material from the COVID vaccine and injected it into another virus, which is given to the patient, but it's non-live. So all the ones so far that are in the phase 3 trials, there are 12 of them. They're all non-live. So theoretically, our patients who are immunosuppressed should be able to get the vaccines that are currently undergoing rigorous assessment. But we haven't seen definitive data yet, and they're not approved yet. So we need a bit more time.
Sure. I'm not completely sure on that point. I think some people have said the Oxford vaccine may be considered as a live vaccine in terms of giving it to immunosuppressed patients, but I guess we'll find that out in the fullness of time. So Anna Reid, thank you very much for your question, but you asked exactly the same question at the same time. So moving on, do we know if the COVID vaccine has been tested on any patients with IBD? That is from Angie Blackshaw.
Mm-hmm. That's a good question From discussions and reading the literature, a lot of the vaccines have initially been reviewed in patients who are healthy between the ages of sort of 18 and sort of 65. There have been patients who have chronic but stable health conditions that have been included in some of these vaccine studies. But I think it's early days to know. We don't have all the details of the studies to know whether IBD patients have been involved in them. And it may be something that's later down the line.
Yeah, so in general, there isn't yet an IBD-specific vaccine trial for everybody listening, but for people in the UK, there is a study running called the Clarity study at the moment. So if you are a patient who's on infliximab or vedolizumab and you attend hospital to receive those infusions, you can and will be eligible to take part in the Clarity study for most of the hospitals which are in the UK. In this study, you will not be given a vaccine, but you will be tested for your COVID antibody status. And you will find that out as part of the study. So the study is looking at whether these medicines make you more likely to get COVID, or if you receive COVID, what effect it has. So if you're interested in that study, it's running from the Exeter team. They have a website called Clarity IBD, Clarity, just as you think you would spell it. And you can look that up or ask at your local hospital whether you can take part. But you must be on infusions of either infliximab or vedolizumab. I think the second part of that study will be offering vaccinations to IBD patients. So a bit of hope there once the vaccine becomes more widely available, but those studies are not yet taken off. Paul Goodmaker, I think you've just asked the same question regarding the vaccine about immunosuppression. Jenny, this is a question about vaccine administration, and Anna Reid has asked about why vaccines, or why is the COVID vaccine given intramuscularly? Is there any other vaccines given in this way? So how are most vaccines given?
Most vaccines are given intramuscularly, on intramuscular.
IM, as we say.
Most vaccines are. The nasal flu spray is quite unusual. That's given through the nose, but most vaccines are given into the muscle. So as babies, they're into the thigh muscle, and then as children and adults get a bit older, into the arm muscle. So it's just that's where it's most effective to be given.
And there's no problems with absorption or anything there.
No, the only people that can't have them that way is if you've got clotting disorders. Then generally we would give you them just under the skin rather than into the muscle. But the vast majority of people, it's fine just to give it into the muscle, and that's the usual way.
Cool. Okay.
And Richard, I've just clarified. So some of the viral vector ones, so where you have the killed bug inside a viral vector, that virus is live. So those type of vaccines will have a live component, and so may not be able to be used for our immunosuppressed patients. There are some other ones that are just components, little bits and pieces. Vaccines that are definitely killed and that are in the phase 3 trial.
Okay. Okay. So the Oxford vaccine is the vector one, isn't it?
It is. Yeah, it's a vector one.
Yep. Okay. So here's your future here, Jenny. So this is from Michelle Holmes, and she is asking, GP land have been told the COVID vaccine implementation period is likely to start early December, with staff having to work 7 days a week. Do you have any inside information as a worker in GP land about the truth behind that? Is that fake news?
I think that's fake news. We certainly haven't been given any information, and because, as you might have heard, that the storage for the COVID vaccines is particularly low. it's unlikely that the vaccines are going to be given in the GP surgeries. They're much more likely to be given in immunisation clinics, centres, and they're going to be held in special freezers, which health boards will have, I know they have purchased. But it's unlikely that it'll be given in the GP surgery. So GP staff, in terms of nursing, we might be involved in having to help administer it, but it'll just be part of the team. So I don't think so.
And on a practical level, just so I suppose people understand the context of immunisations and things at a GP practice, how many people practically can you vaccinate in, say, a morning? Just roughly. So it's trying to understand the scale. If we need to vaccinate most of the population, how much time, how much manpower is going to be needed?
Yeah, so lots. The number of people that we could vaccinate before COVID was obviously much greater than we can at the moment, because of social distancing, about limiting the amount of people that are going through the building and things like that at any one time. So the numbers that we can vaccinate at the moment in any one day are much smaller than they would normally be. There would be about a third or a quarter of what we could normally do in a day. So it really depends, in the terms of numbers that can be done in a day, it really depends on the size of the team and the size of the venue where you are as to how many exactly can be done. In terms of the whole population, or a vast majority of the population being vaccinated, it's going to be a slow process because of the numbers involved and because of social distancing and such like. It's going to take longer than it normally would.
It's going to take Murrayfield, isn't it?
Yeah.
Everybody should be inside Murrayfield outside and just queues of people.
Yeah.
Yeah, something like that.
Something like that, yeah.
Yeah, okay. So back to some questions. Sally, I'm going to let you answer this one, although you might not be able to answer this one, so have a go. So Susan Brown has said, my daughter is pregnant and she has Crohn's disease. Should she still have the flu vaccine?
I think my understanding from having discussed with my IBD colleagues is that you should still get your flu vaccine during pregnancy. It would be the inactive vaccine that you would give. Jenny, I don't know if you have anything else that you would say in relation to that.
Yeah, it's always recommended during pregnancy, preferably before 38 weeks if possible, but it would be given at any stage.
Okay, that's very good. Thank you very much. So, Lorna Diana, my son is 9 on azathioprine, adalimumab, currently 20 milligrams of prednisolone. He has had the flu injection. Does his 4-year-old sister require the injection, or is it okay to get the nasal spray? Before either of you answer, she has said, been giving conflicting advice. Sally, what do you think?
So the current evidence from the UK is that even though you have a wee one who is immunosuppressed, all of the family members can get the routine sort of live medication. So that's in the UK, your daughter would be able to get the nasal spray. There are variations around the world. In Canada, everybody just gets, we don't have access to the nasal spray, so everyone gets the inactive vaccine and all family members, but that's the current guidance.
Jenny, anything to add?
Nope, I agree.
So I think a lot of, this is not a question, this is a comment, and thank you everybody who's joining in here. Really what they're saying in reaction to what we've said is the way the flu JAG is administered, or flu immunisation is administered in different places in Scotland is slightly different, so it's not always through health boards, sometimes school nurses, another thing. So I think everybody's just sharing their experience of how the flu vaccine is given in their particular area. I think the main message all three of us would like to give is, if you think you're eligible for the flu vaccine and haven't had it, then be proactive and contact your practice and find out what's going on. A question that we haven't had, but one that comes up commonly in the clinic setting, is about the HPV vaccine and the importance of that for IBD patients. So do you want to say a little bit about that, Sally, just about HPV and what it's there for?
Yeah, so HPV is human papillomavirus, and that is a vaccine that for our IBD patients is really important. There has been some Canadian evidence that has suggested that patients who are on some immunosuppression, especially medications such as azathioprine, are at increased risk of some of the complications of the HPV virus. And that would be sort of rectal cancers in that area. So as a way to help prevent cancer, we really strongly advise our families to sort of follow the schedule, the UK sort of childhood immunisation schedule, and get that vaccine done. Get yourself protected.
Jenny, HPV vaccine is usually given in high schools rather than GP practices?
Yeah, the vast majority are done in high school, so usually first dose in first year, second dose in second year. But if some teenagers, are a bit needle phobic or whatever, and then it's fine to get it done in your GP surgery. It's not one that we usually keep. We need to order in, but it's usually fine to give it if the child misses it at school.
And just to clarify, it's for boys and girls. It's not just for girls.
Yeah, boys and girls now. Yep. Mm-hmm.
Yep. Okay. We've got a few questions stemming from questions, so I'm going to run through some of these. I'll answer some myself if that's okay. So, Susan McNeils, thank you for your question. Are children on immunosuppressants for IBD at any more risk of serious complications from COVID? You can look back to our previous recording. We had a whole session, 2 sessions on this actually, but the answer would seem to be no. So pretty reassuring data from most places. Sally, would you agree?
Completely agree.
Okay.
And you guys have gone through the secure database and chatted about how well kids have done.
Cool. Paul Goodmaker, so thanks for asking the question. So be 100% clear, are you saying the Oxford vaccine is suitable or not suitable for immunosuppressed based on what you know today? No, it's not, what we're saying.
Based on what we actually currently know, but we'll find out more as the data comes out.
Yeah. So Jelena Good, thank you very much for your question. On the same theme but slightly different. So far it sounds like immunosuppressed people aren't being included in earliest priority groups to receive a vaccine. Is there any likelihood of that changing? So there's a good side and a bad side to this. The good side is that patients on IBD on immunosuppressants are not a higher risk group, so your risk of COVID is not higher. So overall, that's a good message and reassuring. However, I can understand exactly why you would want access to a suitable vaccine. So as I mentioned, I think the follow-up to the Clarity study will be a vaccination programme, and there is a vaccine coming from University College Hospital London, which is going to be specifically targeted at people who are immunosuppressed. So because most people in the population aren't, as Sally said, the first vaccines are aimed at the big population, and then specific other populations then are targeted after the initial vaccination is passed. That might seem fair or unfair in some regards, but that is the way things are rolling out. So yes, UCL are doing a vaccination programme for immunosuppressed patients of a killed vaccine, but it's at an earlier stage, phase 2, if you're listening to Sally's presentation before. So it's gone through the initial safety studies, but it hasn't reached the bigger studies yet. Somebody asked about Clarity. and whether that's running in Scotland. Yes, it is. So although it's based in Exeter, it's a UK-wide study. So we're certainly recruiting through both of the children's hospitals in Edinburgh and Glasgow, and in Dundee, and large adult hospitals in Glasgow and Edinburgh and the surrounding areas are also, in all those three cities, are recruiting as well. So if you want to join, the study closes a couple of days before Christmas. So you need to get yourself in shortly. So I wanted to ask a practical question now, just about people are worried about immediate side effects and things about vaccination. So what advice, Jenny, would you give to children who are about to receive their vaccines, for parents who are worried about they might get a fever or other things? What advice can you give them?
Okay, so just any vaccine, Richard?
Yeah,
just any vaccine.
There's standard vaccines, yeah, routine vaccines.
So if it's a vaccine that's been injected, it's normal to get a little bit of redness around about the site of the injection. It might be a little bit hard, and that can last for a day or two. If the redness extends and appears to be really quite painful for the child and is longer than 2 or 3 days, then it's a good idea just to get somebody to check that out. So a little bit of injection site discomfort or pain is quite normal for 2 or 3 days.
Okay.
So yeah.
So, and I think it's particularly confusing just now with COVID. So if you've had a vaccination and you develop a fever, is the advice any different, or? So
some children definitely do get a fever after having a vaccine. So that would usually, if they're going to develop that, it would usually happen that evening, possibly into the next day, but it wouldn't extend beyond that. So if they do have a fever that's beyond that period, then, it would be worth seeking advice as to whether a COVID test would be appropriate. Yeah.
Sure. It would be bad luck, but these things can happen. Thank you very much. So Lynn Owens, lovely to hear from you, Lynn. Great session, guys. Thank you very much. Concerns around COVID vaccine. Thank you for your advice. This is for you, Sally. So can I ask, re the men ACWY vaccine? My daughter, who's on ustekinumab, missed this at school. Is she safe to take this? And if so, will it be at the GP or the immunisation team?
So I'm not sure I can answer the practicalities portion of that because of the UK schedule, but it is a non-live vaccine. So it is something that is recommended before you go to university. And so maybe, Jenny, do you have more information about kind of where she would potentially get that?
Yes, so she should be able to get that from our GP surgery. Again, just let them know and check that they've got some stock in, but yet that shouldn't be a problem to get it done there.
Okay.
At the same time, there's the diphtheria, tetanus, polio. The last of that is offered at the same time as the meningitis ACWI. So it might be worth just finding out if that's needed as well. Okay.
Excellent practical advice. Thank you very much. So we have a follow-up about the HPV vaccine here. And Jenny, this might be more for you. So this is from Laura Martin. Thanks, Laura. Just a follow-up question on HPV vaccine. Should adults on immunotherapies request this vaccine? She's in her 30s, so she was too old to get it through high school as people would now.
No, because it's likely that she will have been exposed to the HPV, so it wouldn't be offered, and it's not worth getting.
Okay, thank you very much. Sally, anything you want to ask to that, or it's outside your age group?
Guidelines are a little bit different in Canada, so if you're up to sort of 35, 40, they're still offering the HPV vaccine in Canada, but it's nuances, I think.
Yeah.
Okay.
Yeah.
So it might be worth on an individual basis just asking that question of your IBD team, Laura, and just see what they say. So April MacBeth, thank you for your question. So April is a care worker with IBD, and I'm meant to be in the first group to be vaccinated. So am I correct in thinking I should refuse if offered a live vaccine? So at present, we don't know what vaccine you might be offered. So it would be important for you to say you have IBD. I'm assuming that you're on therapy, and that's why you're worried about a live vaccine. But there are 3 potential vaccines which the government have bought. I think you're most likely to get the Oxford one, so it would be live. But if it was one of the other 2, then it wouldn't. So perhaps you should just, I think they will offer more than one vaccine availability, but just if you haven't seen this, the reason why the Oxford one is going to be commonly rolled out is because it's made in the UK, the government have bought lots of it, and it's very practical in terms of being given. So it's stored in a standard way for a vaccine, whereas the other ones are stored in -80 freezers, which there aren't a lot of. Jenny, does your practice have a -80 freezer in it, or is there? No?
Definitely not. No.
So you would have to buy new freezers, or they would be done in a central place away from practices, or?
Yeah, it's going to be done in a central vaccine centre away from GP practices. Yeah.
Okay, so Lee Flower has asked us a question. So based on your previous comments, thank you, Lee, I've been led to believe that people with IBD on immunosuppressants are high risk. Has this changed? Sally, do you just want to go over that question?
So people on immunosuppressants are high risk of, what does it say specifically? Just high risk?
Yeah, it doesn't actually say infection or coronavirus. So
yeah. So there is a background increased risk, susceptibility to infections, especially for our patients inherently with inflammatory bowel disease, especially if you're maybe nutritionally in a more challenging spot, if you've had a nasty flare-up. But the biggest factor really is the medication that you're on. And if you're on immunosuppression, your ability to fight off bugs is just not perfect. So you are at risk generally of picking up more bugs. But in terms of COVID, as Richard has already sort of alluded to, we're not seeing the signal that our patients on immunosuppression are particularly at a high risk of developing severe COVID, especially the pediatric patients.
Great. So guys, we don't have that long left. So if you have any burning questions, your time to get them in is now. If you want your questions answered, we do have a little more time, but not that much time. So get your fingers to work if you want to ask us a question before the end. This is a question from Kate Gibson. Thank you, Kate. If an IBD consultant recommends their patient should have a vaccination, no matter what age they are, then will this always be given within our GP surgery? Jenny, do you want to answer that one?
Yeah, it should be. Usually the consultant will write to the GP and just request that it's given. And I haven't ever known any circumstances where we haven't given it.
Okay, so sounds like the answer is yes then.
Yeah.
Just before we end, we haven't had the chance to talk about chickenpox vaccine very much. So in Canada, Sally, is chickenpox vaccine part of the normal vaccination schedule?
Sure, yeah, it is. So it's given during the childhood immunizations, 2 doses. And so that's a difference from what happens currently in the UK.
And so if a patient hasn't had chickenpox, Jenny, and they have IBD, but they're suitable for vaccination, that I'm right in saying that could be given in the GP practice?
It could be given, but it's not something that is given regularly at all. The only instances that I'm aware of that it's given is to pregnant women if they have got a risk of, if they haven't had chickenpox previously and they're at risk of exposure to it whilst they're pregnant. It's quite unusual in the UK to get the chickenpox vaccine.
So from our own work sponsored by the Catherine McEwan Foundation, we've looked at how common chickenpox is in patients with IBD at diagnosis, and around 10% of patients will not have antibodies to chickenpox. So those are the patients. There's only 4 or 5 per year, but they will get their vaccination done usually before they go into any of the immunosuppression steroids that Sally mentioned. So before we close off, Sally, this one's for you. So Paul Goodmaker, he's asked 2 or 3 questions, but he really wants to know about the vaccines that might be suitable for him. So Oxford isn't suitable. Are Pfizer or Moderna suitable?
My understanding now, I have to caveat this with, I am a pediatric gastroenterologist rather than a vaccine ID specialist, but based on looking at the literature, those other vaccines are RNA based. So they're little bits of the genetic makeup, broken up bits of the genetic makeup of the coronavirus. So my understanding is that they are dead. And so should be less of an issue in terms of being given if you're immunosuppressed. Yeah. But we need the studies.
Cool. Excellent. So listen, I think this has been an absolutely fabulous session we've had tonight. I think it's been one of the most popular. We have exhausted Jenny and Sally with all of our different questions and testing their very practical to scientific knowledge. So I think they've done a great job. I'm going to give them an individual round of applause. And I know that all of you are doing that, but we can't help you. But we can't hear you, not help you. Of course we can help you. So I'd just like to finish up by saying, please share the feed. Please share this session. I think lots of people who haven't had the chance to listen tonight would really benefit from this session based on all of your questions. I'd like to say again a big thanks to Sally and to Jenny for taking their time to take part in the session tonight. And thank you very much. Take care. Get your vaccinations done, and we'll see you all soon. Thank you very much. Bye-bye.